Welcome to the Ambronite Superhero Podcast with Simo Suahemo. This show is your backstage pass to discussions with world-class influencers in the field of health, nutrition, and high performance. We bring you the selected tips and insights that you can use to upgrade your life and become unstoppable.
Right. After a good lunch of some healthy hormetic vegetables, hormetics containing vegetables, I'm sitting here with Dr. Christian Mueller, MD, and Nutrigenomics researcher. And today, we've been talking a lot about genes and genetic testing, Christian, today.
That is true, yeah.
And one of the interesting things I just found in yesterday's news was that a team of researchers in the UK has identified one of the COMT gene expressions as being linked to learning languages. And the gathering or the development of white matter in students during their foreign language course. And they could actually, through a gene test, determine with a significant level of significance the success and the rate of learning of a foreign language by looking at a certain expression of the COMT gene. I think that is pretty impressive. What do you think about these types of findings?
Yeah, I mean, there's a lot of findings which are basically researchers are trying to connect certain genetic markers to certain abilities of the human body or of the humans in general. So, for example, there's a lot of research going on trying to connect certain SNPs or genetic variations to intelligence, for example. And this is the thing about, for example, if you take intelligence as an example, it is not just something you can break down very easily and say, okay, there are just two genes which are actually responsible for building up a certain level of intelligence. So intelligence is something we would call like multifactorial, which means a lot of different genes are involved, but also, of course, the environment. So how you've been raised, if your full potential is being used, basically, in order to form those new connections between the neurons. So
right. Yeah. I think when things get really interesting and futuristic is when we're hopping one step further from measuring what we have into creating or modifying what we have.
That's really the next step. Yeah. So then we're talking about gene editing or gene modification, which is a rather new, I would almost call it a hype in the field of genetics. But you also have to keep in mind those genetic modification methods. They have been around for, I would say, even a decade or even more than that. But back in the days, methods like zinc finger proteins or tallins, they were rather more like a sledgehammer in terms of trying to modify your genome.
Right. So not very fine-tuned tools.
Absolutely not very precise. So, and a lot of unwanted mutations basically occurred if you were applying those kind of techniques. And also they were immensely costly. So I still remember there was this zinc finger protein approached like $5,000 or something just for the protein itself.
Wow.
So this is just from an economical standpoint, it was not really feasible in a broader scale. And so new techniques were developed, and now we're at a stage where we have something called CRISPR-Cas9. And this is you should think of that more or less as the scalpel of gene editing, which is really enabling us to make precise alterations inside your genome.
Right. So with this CRISPR-Cas9 technology, is it already possible to, for example, get your children's genes edited or edit your own genes, or what's kind of the scope that we're at currently?
I mean, I would say the possibilities are endless. I mean, the applications are basically endless. Of course, you have to watch the ethical standpoint here and decide on how far you want to go with that. But again, possibilities are endless. And it's not that we are actually really trying to think about if a designer baby would be possible in the future. It is possible. The question is...
It's possible.
It is. The question is just, do we want that? Do we want to go as far as designing the perfect, let's say, offspring, right? To have the perfect baby with the perfect eye color, with the perfect hair. Yes, that's just a question of upon if we want that, yes.
Yeah. I guess in countries with way less regulation in this space. For example, in China, I suppose there are already pretty advanced human trials, if you will, going on in this space.
Absolutely, I came across several papers from some Chinese research teams where they were actually already like applying CRISPR-Cas9 techniques on human embryos, where they were trying to, let's say, cure a certain illness which was connected to the blood, so a blood cancer type. And I think those trials were successful. So they were showing us that it is possible, yes.
That is intense. I think, many people might have this dystopian view that this will eventually end up in segregating our society forever and kind of, like building this divide between the people who can afford this technology to engineer themselves and their children, and with a population with no access to this type of technology. I personally have, I can see, arguments, pros and cons again for that argument. But in general, I feel that this is an exciting new space where we can essentially transcend our own capabilities at some point.
Absolutely, right. And right now, I mean, the applications, you shouldn't think about those applications just for, let's say, an early stage embryo where you want to edit something, but also things are getting interested when you look at, okay, how we actually can change the genome of an adult person, right? If the adult person already has a certain disease manifested, a certain inherited disease manifested.
Right. Do you have any examples of the diseases we could?
For example, you can think about like cystic fibrosis, CF, which is caused by a certain mutation in the CFTR gene, which codes for a calcium channel, and by that actually alters the viscosity inside your thorax, where the lungs are basically are. So if the viscosity of that fluid is getting too thick, that person is much more susceptible to infections. And in the long run, the only thing to cure those people in the past was basically a lung transplant.
Right.
And their life expectancy was maybe 30, 35 years, 40 years. Of course, it's getting better by using modern antibiotics and modern treatments, but still their life expectancies were short compared to someone who is not having that kind of mutation.
And is this, for example, for cystic fibrosis that you mentioned, is this already a reality that you can travel to some part of the world and get this treatment done?
I think the researchers are currently working on that. I'm not sure if it's already. I'm quite sure it was not applied yet. There are other ways right now to try to handle that situation, but more or less not really treating the cause, but treating the symptoms, basically. So there is.
Well, let's go into that.
Okay. Anyway. Okay. There's a drug which basically is a opener of that calcium channel. And by that, the viscosity gets restored. But still, the drug is not, just lost its approval here in the European Union. And also the problem is that drug is just only approved for certain mutations inside the CFTR, inside the gene. And so it is not like this complete solution for people which are actually having that disease, basically. So we really should treat the underlying cause of the disease instead of just treating the symptoms here.
I could certainly imagine applying this to myself if it were a situation of a life and death, or like even something that would have the potential of expanding my lifespan with decades if I would be diagnosed with something grave like this. What are your kind of personal views on, for example, enhancing your own genetics?
Yes, I mean, it is also interesting in terms of longevity, I guess, right? Which basically affects all of us. So we all do age, and we all, maybe not all of us, but a couple of us, we still want to live as long as possible and to enjoy life to the fullest and make the best out of the years we're getting here. So there are interesting trials or interesting things are happening in the States right now. I think there is one of our listeners have heard of her, but her name is Liz Parrish, and she just recently was patient number 0 for undergoing gene editing in terms of lengthening hair telomeres.
Right.
Yes. So
telomeres, if you can just briefly explain to the audience.
So telomeres are the end caps of the chromosome, basically. You just can think about it as like really the end piece of your DNA. And all the time when the cell divides, those end pieces are getting shorter and shorter and shorter. And by that, there's a pre-programmed, let's say, end life cycle of the cell. And if you just could lengthen those telomeres, you would also increase your lifespan, expectancy or lifespan, basically. And so she was, and lengthening something like this is achieved by telomerase. And I think Liz Parrish, she went somewhere to Mexico and she had that procedure done by a doctor which she's, I think, in close contact with, because I think she also set up a company or something, but I don't want to endorse it here. So, yes, in combination with the company and that a doctor who is specialized, I guess, in gene editing, she became patient number 0 for that. And they were doing several tests. I haven't seen the results yet, and I haven't seen her blood work, but she's claiming that it worked and her telomeres were lengthened, yes.
Wow, that's intense. So, yep, please go.
There might be some uncertainty because the problem is, of course, always how you measure actually telomere length. So if you use like different techniques to measure the telomere length, you might come up with different results.
Right.
So it's really about standardizing actually the test and how you measure, quantify the length of the telomere. So there's a bit of uncertainty in here.
Very, very fascinating. I did the 23andMe test, and some of the indications pointed to having especially long telomeres, and also some of the results returned an increased likelihood of living for over 100 years. And personally, I find that exciting and empowering, even though it's very hypothetical. Do you think we can, using these technologies, we will during our lifetime see humans living to over 150 or 200 years?
I mean, if you ask me, and probably also if you're going to ask Aubrey de Grey, I mean, probably we both agree that we will see. We will see people who are living like longer than 150 years still in our lifetime. And I mean, we talked about telomerase or telomeres, but that's just like one sub mechanism, which is actually influencing life expectancy. But there are a lot of other ways and other targets we basically can attack or change or modify in order to increase longevity.
That's a fascinating topic. Also, a lot of ethical controversy, as we mentioned. Have there recently been any major breakthrough that you've been especially excited about, looking from your own research lens?
So, I mean, of course, the CRISPR-Cas9 system could be seen as a major breakthrough, and certainly it is. But even that system is continuously undergoing some sort of evolution, basically, to refine that system even more. So there are certain approaches which are not even called CRISPR-Cas9 anymore. They're called differently, and they're supposed to even work more precisely, being cheaper in their application. And so just in that, let's say, little space of gene editing, we see a lot of development being done. And of course, I mean, every company is pushing their agenda further, maybe to patent their own SIM system, their own gene editing system, in order to get a certain market share and sell their product, basically.
Right. Looking at the future of having this type of technology, like pretty much embedded into society. I mean, like it's right now it feels very radical, but so did vaccination at some point. Do you see a future in which babies can be instantly cured out of, say, genetic predispositions for very grave diseases as a standard procedure, or would that take place later in life? Or how would it go?
So it's already being done, basically. So if both of the parents are basically carrier for certain mutations, and the chances are great that also the kid, the unborn baby, will have that disease and become maybe homozygous in that disease if it is a recessive disease, then there, for example, in Germany, it is allowed basically to do a screening of the embryos and see if of course, select only the unaffected embryo.
Right.
So that kind of selection, and we also, let's say, expand that and further also incorporate not just screening, but also editing methods.
So in Germany, this type of screening is also...
which have to be fulfilled in order that the screening is allowed. And but yes, it is.
So some people are also advocating on pulling the plug on this type of research and this type of editing forward while adopting these types of moral guidelines, or even pushing for some kind of a global legislation on what can be. I guess this was rather my own thought here, that there seems to be a divide among the people and are producing very different kinds of, like future scenarios. Yeah.
But basically my answer to that would be then setting up ethical committees and trying to make sure we are not pulling or pushing that research too far, but we'll do it anyway. So, I mean, you cannot establish this regulation which will just impact the whole, which is just doing things.
Yeah, it will kind of, either it will be public or it will go underground. And then even dozens of other countries where this is also seen as a strategic asset.
Absolutely. But also keeping in mind that, those techniques, of course, they might seem complicated, but still, if you're interested, especially, in the future, but also right now, actually, to experiment that by yourself in your backyard, doing hacking scene there, and which are trying to use that kind of applications. So it is not really unthinkable dog embryos, and trying to figure out, and it's just a matter of time until scenario here, but it is thinkable certainly.
Yes, yeah, so. I think it holds great promise on what we could imagining massive scale ultimate soldier developing kind of the warriors of the future, gene edited, and a dystopian thought of gene editing viruses or gene editing something that could...
The government decides to make their soldiers resistant to a certain virus. So on the battlefield, they will resistant. But of course, obviously the soldiers of the other, let's call it team, or their other country, whatever, are nuclear warfare, which is basically based on eugenetics. So.
Yeah, this sounds like something straight out of a sci-fi. Really living in the future here. Do you think it's already possible, like theoretically possible, to have weapon that could, for example, only attack a certain part, even people at a certain stage of life, like something that would only affect a typical.
What is certainly possible right now is that you engineer viruses which are just attacking a certain, let's call it a certain part of you, for the whole CRISPR-Cas9 system in adult people to actually, if you think about the CRISPR-Cas9, getting it inside the cell needs a certain transportation vehicle, a certain vector. And the vector is usually a virus. Inside the virus, and the virus attacks the body part or the body subsystem, which actually needs the gene editing. Just let the virus attack a certain subsystem of your body. Caucasian people or only Latin people, I think we are still far away from that. It's of course also something. So
right, sure.
And it might be quite unethical as well. So
yeah. And that's probably highly classified.
It might be highly classified, and you do. So.
Yeah, definitely not. Yeah, I think this is more in the domain of the typical, some of the most typical sci-fi and alien race developing a virus to destroy all humans in the galaxy, or the other way around, or last minute solution to an invading alien force to infect them with a common human flu to be able to save our planet in future there. And even though there's pros and cons and the light and the dark side, I'm very hopeful that we'll of the whole planet with these technologies.
Absolutely. I'm just hoping that we are using the technology not for trying to, but more or less really trying to cure inherited diseases and really use it for the right cause. Right? And immediately the military was taking it for their own applications, and he was regretting CRISPR-Cas9 and the whole gene editing thing. It's always thinkable. The military is usually always the first adopters and teaching, and will improve life on Mother Earth.
I'm sure. I'm sure. Apologies. Thank you, Christian. This has been truly insightful.
Thank you, Simo, for having me.
Thanks for listening to the Ambronite Superhero Podcast. Please check out the links, show notes, and other episodes at ambronite.com/podcast. That's AMBRONITE.com/podcast. Thanks again, and catch you in the next episode.